Hospital services remain paralyzed in Nakuru County, even as Nakuru County government resolved to involve the Labour Office to lead talks. The health workers' strike has entered its second day, with health workers vowing not to relent until they are given their delayed promotions, salary arrears and missing allowances. And as KTN's Kamchemenza now reports, Nakuru Deputy Governor Joseph Ruto says a crisis meeting this morning with the health workers did not bear any fruit.
This is Rift Valley Provincial General Hospital, one of the hospitals whose health workers have downed their tools. Patients left without services, some left with no option but to leave the facility. Some wards left empty. And this is the casualty area. Behind me are some of the patients who have come here today to get treatment. On this side is the cashier area, but it's closed. Clear evidence that there are no operations going on here. Outside this door are more patients who are waiting to be attended. We met a patient whose relatives have opted to transfer him to a private hospital.
Tulikuwa tutoka either leo tomorrow, lakini by yesterday when we came here, tukaambiwa na madaktari kila mtu aende mahali anajua na mgonjwa wake. Nikaenda Nakuru Afra Maternity, mlikuwa imejaa, but by this morning nimepitia nimeambiwa Nakuru Nursing wamepata nafasi. That's why tunamtoa tunampeleka Nakuru Nursing Home.
Lilian Atita says she suffers cervical cancer and was meant to have her operation done.
Sasa wakati nikuja nikibleed waliniambia tuwezi nitoa kama na baka ni hiyo bleeding isha. Sasa hizi bleeding imesimama. Sasa hakuna vile naweza saidika. Sasa kama ma documents zangu zote ziko huko ndani. Hata nikienda hospitali nyingine sasa siwezi pata nini.
Their stories are not different from the many others stranded here, just having to bear with the pain.
Services hospitali kwa central government. I think that is the best way. Kwa kulikuwa na central government was very well upate mambo kai. County government can manage the hospitals. I don't think so. Solidarity forever.
Led by KMPDU National Chair Samuel Oroko, the union issued a strike notice to the county government for failure to implement what they say was agreed in a series of meetings. This is the 7th strike since devolution.
And the governor himself promised to have effected all the promotions by June this year. And the June went by with no promotion.
We have people, arrears are running into hundreds of thousands of shillings. The job groups of people have stagnated. Career progression is stagnating. And at this point, the only thing that keeps us in this poorly paying civil service is career progression. So if there's no career progression, why would we serve an undeserving master?
The counties are mismanaging the healthcare workers. The counties are not buying drugs in the hospitals. The public is suffering. Corruption is the highest in counties now as we speak. And all this, if not addressed with urgency it requires.
But according to county government, it will be impossible to meet all the workers' demands immediately. The county says they have tried to do so gradually, such as promoting 144 staff.
That is to show we are very much willing to do the promotion. The issue of allowances that were removed from the payroll, we shall reinstate for everybody. And that one was human error. We cannot say it was intentional.
A meeting between the two sides that saw the county promise to effect promotions in 3 phases from 1st September, with arrears payment from October, failed to yield a solid pact.
We want to forward to Labour Office to make reconciliation.
But until then, the fate of the patients hangs in the loose, and the pain continues in the Nakuru public health facilities. Kamchemenza, KTN News, Nakuru County.